My name's Reilly. I'm the CNIO and the VP of Clinical Operations at Imprivata. We're a digital identity access management company focusing primarily in healthcare, but have moved over into the commercial side. I myself manage the clinical team. We roll up to a chief medical officer. So myself, my team, our role is purely healthcare.
Got it. Excellent. And so in terms of the workforce that's utilizing the platform or that might engage with Imprivata, so in healthcare, so we're talking about doctors, nurses?
Yep. So we're talking about all personnel in healthcare, primarily doctors and nurses because they're the biggest workforce in healthcare. But we're also looking at EVS, which is our stable diet of housekeepers, which is instrumental within healthcare. Our transporters, our what we call back office, the billing.
Yeah.
Huge piece, particularly here in North America. A little bit different in our international space, but the billing space in healthcare in North America is huge.
Yeah.
When we look at our international market, it's a single payer. So it's a very different strategy. We're still back office staff. So we really support everybody from the front door all the way through, up and out through the back door.
Got you. And what kind of information and engagement are people having with Imprivata platforms? Is like clinical information going into the platform?
We're about the end users. So what we do is we own the identity of that end user. So when I badge tap into a workstation, yes. I've been enrolled in Imprivata it's commonly known single sign-on. We've just rebranded, but we'll use single sign-on because I think that's what our end users know today. Yeah. So we badge tap, we unlock that workstation. Now we know Claire's in that workstation. Mm-hmm. And then depending on Claire's role and her security privileges, we let Claire around that workstation. So that means we'll let Claire into an electronic medical record. We'll let her into a email. We'll let her into any other applications that she uses. We'll let her into a HR portal. Whatever her privileges, her security privileges allow her through and what she needs to deliver her care. So we own that identity of that end user. And then when we bring that end user out of that workstation, we badge tap, and then in the back end, we close those applications and secure that workstation.
Yeah.
So importantly, to me, the end user, everything's executable through the badge. I don't need to know how the sausage is made. I just need to know that I badge tap in, I unlock the workstation, and then I have what we call our single sign-on into those applications. And then I badge tap out, that's our best practices, and then that workstation is secured.
Yeah.
And ready for the next user. And then, of course, we have a default, because wherever you put humans, there's going to be technology blurbs. Because I come to work to save lives, as my colleagues do. We don't come to manage technology. So if I walk away and I don't close out that workstation as I described, you will badge tap, and then Imprivata knows that you're also a single sign-on user. We'll close all our applications, and then we do what we call a fast user switch. So we close Claire out, and we bring you in.
So that's really clear and sounds really important in that in a hospital or a clinic setting to have that, I guess, secure and robust process around managing identity and people. It's interesting you said at the start that you being a registered nurse and come from the ED background, but also with the clinical team. It doesn't sound like, on first glance, it doesn't sound like overly clinical or medical stuff that Imprivata is doing. But if it's so focused on the healthcare side, that must mean that you've got a lot of understanding of what the clinical workforce are feeling firsthand, right?
Exactly. And the role of my team at Imprivata is understanding those clinical workflows, but equally as important, understanding that footprint. So wherever you put technology, wherever you're asking end users to use technology, understand their workflow, understand their footprint. That drives efficiency. And I always say, if you drive efficiency for me, I'll ensure security for the business.
Yeah, that's a really important piece that comes up around the workflow side from the nursing piece. Often in the discussion around efficiency and getting things done faster, better, stronger, usually the conversation's coupled in with this point around increasing issue of workforce burnout. And that's one that I know that you're particularly passionate about.
Correct. Physician clinical burnout is a very hot potato. It's also a buzzword, and it really gained legs and strength during COVID, and it's a real part of the world that we live in today. Clinicians, physicians, and anybody really within healthcare are burning out, and we need to look at what are we doing to preserve and retain that workforce. And really, it's a challenge. It's a challenge. You can look at salaries, you can look at working conditions, but in the world I'm in now, we have to look at technology and what we're putting onto those end users. Are we really doing them the best service? Have we engaged them? Have we included them in that delivery of technology? And that's where my team come in to make sure that we are in your corner, we do have your back, and we're not just delivering another burden to you. And it is a burden. Going to work every day has become a burden. We have short staff, we have resource constraints across healthcare, and we also have financial constraints that have been highlighted and exaggerated since COVID.
Yeah. Something I was thinking as you were talking too, it's one thing and a very important thing to really understand the clinical workflow in and of, say, a particular so whether it's a nurse workflow from start to finish, but I think where a lot of pressure also happens too is that kind of when we're crossing different disciplines within a hospital setting as well, like going from the nursing through to the admin side. But I guess you've got that visibility across all those different functions, right? Tell me a bit more about that.
Yes, so as an emergency room nurse for many, many, many years, I've done many leadership roles where I do cover that continuum of staff from the back office to the boots on the ground, as we say, the upward and outward movement of those patients. So I do have that area of expertise, which is the value that myself and my team bring to Imprivata, because again, when we're layering technology in, we've got to include everybody that we're touching. We've got to drive efficiencies. We've got to make it seamless for them. And the seamlessness drives the security. And that's really key. We can sell the technology, but if we don't deploy it appropriately and engage the stakeholders, it's never going to be utilized. And it ends up with what we so commonly know as shelfware. Yeah. And Imprivata prides itself. We have a very large, relatively large in the industry of a clinical workflow team. Yeah. Primarily out of North America, but we have support in the international market out of the UK. And we do pride ourselves on when our sales force go in, we're tagged with our sales force to make sure that we are addressing the end user. Like I said, whether it's nurses, doctors, EVS, transport staff, back office staff, making sure that we're understanding their workflows and their footprint.
And I guess that then if I was to extrapolate that, you kind of did this a little bit already, but understanding the needs of the front line, that's really important, and addressing workforce burnout issues, making, I guess, the day-to-day easier and more effective. But that then has implications at the organisation level around, the efficiency side of the piece. But I imagine too, from the security side, when errors happen, usually it's when they're human errors. So if there's ways to reduce that, then I think all of these issues are all interlinked. And I imagine that also flows through to the patient as well. So by able to provide patient.
It does. And it comes back. If you don't teach me what I need to use, there's going to be a human error. Or I'm going to try and learn it myself, because I kind of like the idea of the technology and it has some value for me. But if I don't learn the start to finish of the workflow, I'm going to create workarounds. And then that drives, some error, whether it's technical error, whether it's documents in the wrong patient, whether it's direct patient error, suboptimal outcomes with patients. So my team at Imprivata, and I do giggle to myself because I do open up on many conversations saying, I'm now boring myself, but can you please make sure that clinical's engaged in these conversations? Because that's our role, to mitigate error, not only on the end user, but on the patient side of the house, which is key patient safety. And we can mitigate a lot of that if we take the time to educate the end user.
Hey, look, lastly, then I see that Imprivata's got a great presence here within HIMSS and a lot of conversations going on. What are you hoping to take away from this event, or what can we look forward to seeing from Imprivata over the next 6, 12, 24 months?
So it's interesting. It's very timely. We do have a new CEO at Imprivata, Fran Roche, and he's in his first 100 days. Okay. And he obviously is learning Imprivata and looking to strategize. And as of, I think it's the 1st of April, we're going to have a roadmap. Where are we going and what's our direction? Will there be some change in the course of our direction? We anticipate there will be, but for the better. But what we do know is that healthcare is going to stay the centre and the real bread and butter of our technology. And we're looking at innovation. How can we innovate on what we've got? Because we really want to make sure we have a large customer presence around the globe. And we want to make sure that we innovate on A, our technology, but B, how can we innovate with you, and how can we make sure that you're getting a return on our investment? So lots of changes to come. I don't know them all yet, but we're very excited, and it's exciting times.